today I'm going to be showing you how to insert an indwelling Foley catheter using sterile technique. So the first thing you want to do is you want to ensure that you have an order from the provider to insert a Foley catheter. You want to make sure that you have the correct size Foley, as they come in different sizes, and making sure that it is the one that matches the order, such as a 14 French, okay, which is what we have here. The next thing that you want to do is when you go into the patient's room, you want to introduce yourself, of course, provide privacy, verify that patient's identity using two identifiers, having the patient state their name and date of birth, remembering to look actively at the patient's bracelet to ensure that the name and date of birth they are stating matches their identification bracelet. Then you're going to explain the procedure to the patient, letting them know you're going to insert a sterile rubber catheter into the bladder to allow for monitoring of urine output. Okay. Then what you want to do is to verify any allergies. Remember, you do not want to be vague and just generalize or just ask in general, do you have any allergies? Patients always think you're talking about medications or food allergies. Be specific. So with this particular procedure, one allergy that we should verify is an allergy to latex, okay? So, because you're going to be using gloves, and most of the gloves and stuff right now on the market are latex free. However, when it comes to Foleys, there are Foleys still on the market that contain latex. So you want to be sure, if that patient states that they have a latex allergy, that you verify that your Foley does not contain latex. Now, the second allergy that you want to verify would be betadine or iodine or shellfish. Remember, betadine and iodine, they are extracted from shellfish. So if the patient is allergic to shrimps or crabs, anything like that, they will also most likely have an allergy to iodine or betadine. So that you also want to verify that. Also, when inserting a Foley, once we have completed the insertion of the Foley, we often secure it, will always secure it with what we call a stat lock device. And on the back of that device is an adhesive. So you may want to ask the patient about adhesive. We also use lube during a Foley insertion. Not very common for patients to be allergic to lube, but it does no harm in asking. Okay. So once we have verified that we have an order, we have the correct size Foley, we have the correct patient, we've explained the procedure, we can go ahead and verify allergies. We can go ahead and get ready to start our procedure. Now, for checkoff purposes, you will not have to perform what we call perineal care, okay? And that simply means cleansing the patient's vaginal or penis area with warm water and soap, okay? And this is just to ensure that we remove as much bacteria as possible before inserting the Foley, okay? Now, for checkoff purposes, again, you will not be required to perform that, but we do want you to state that perineal care has been performed. During the time, if you ever have a chance, or when you're in the clinical setting, you always want to use that time when you're giving perineal care to clean the vaginal or the penis area. You want to be sure to look at the patient's anatomy, okay? All anatomy is not the same. That way, if you're having a hard time when you are cleaning the perineal area, if you're having a hard time identifying the urethra, you may want to reach out to a nurse or CNA to assist you. Also, your patient may not be able to keep their legs in a frog leg position, and I'll demonstrate what that is, for very long. So having assistance available, this is the time that you would be able to determine if you need that extra hand, okay? So now I'm going to go ahead and get ready to get my patient in position. So I'm going to start by laying my patient as flat as possible. Now, in the real world, you will have patients because of certain disease processes such as COPD or emphysema. It is very hard for them to tolerate lying totally supine or flat. So you always want to verify with your patient what is their comfortable or most comfortable position. Okay, so as you're lowering the head of the bed, just having the patient to tell you, hey, that's enough. Okay, so my patient has no issues with lying totally supine or flat. So we're going to do that. You want to make sure that your bed is at a good working height. Okay, so you want to make sure that the bed is high enough so that you're not putting strain on your back. Okay, and this level is pretty comfortable for me. Okay, so now what I'm going to do is I'm going to go ahead and do my hand hygiene here. And I'm going to put on some clean gloves. Remember, these are clean gloves, not sterile gloves, okay? And right now, we're not starting our sterile portion of this procedure. So we just want to go ahead and put on some clean gloves and get our patient in position. All right. So what you want to do, and this is just something that I do. You don't want to totally expose a patient. Sometimes this is, the patient is already in a very uncomfortable position. They may be shy. So instead of pulling their covers all the way down, pull from the bottom, okay, as such. And you want to fold the covers back. This gives the patient some sort of feeling that they're not totally exposed. And also, when you're dealing with the elderly and so forth, they may get cold. Okay. So now I'm going to go ahead and get my patient in position, making sure that I've asked my patient ahead of time if placing them in a frog leg position such as this would cause any discomfort, okay? Because then we would have to modify as needed. So now I have my patient in position. Remember that perineal care has already been performed on the patient. So that is already done. We've already taking a look at the patient's anatomy. Now, I will tell you this, when you do your procedure, these mannequins, they are very stiff and it can be a little difficult to expose the urethra, but we just want you to do your best without contaminating. Okay, so I have my patient in position. Now, either way you do this is up to you. You can get your patient in position now and then prepare your sterile field, or you can go ahead and open up your sterile field and then get your patient in position. It's totally up to you. You just want to take into consideration your patient. If they're not able to stay in this position long, then waiting to put them in this position after you've opened your sterile packaging, right before you put on your sterile gloves, you can then put them in position. So I'm going to just sit this over here. Okay. So go ahead and cleanse my hands. Now, again, just like our wound kits, our Foley kits have what we call these dust covers, and you remove the actual kit from the dust covers. Remember, this portion is not sterile, okay, because we got to touch it. All right, now, normally I prepare my sterile field on the table, but for demonstrations of this, I think for visibility, it may be easier for you guys to see if I open the sterile kit between the patient's legs. Just keep in mind, whichever method you choose, look at your patient. If your patient is not really keeping their legs up or still or letting one leg drop, you may not want to bring your sterile Foley over between the patient's legs until you are ready to begin insertion. Okay, so our package, you see it here. It should be facing you as such so that you are opening away from you. Okay, remember, open away, then side to side. And remember, I'm going to open the corners as such and then towards me. Okay, keeping making sure I'm just touching the corners. Okay, so now again, I have some sterile gloves on top. I won't really be using those, so I can just leave them there and go ahead and put on my sterile gloves. However, if you're going to be using the gloves, you want to make sure you just pinch the gloves itself, not touching anything else, and you will put them on at an area away from your sterile field. Okay, now I'm going to go ahead. Remember, anything that falls below the edges of the table are not sterile. 2 inches from the edges is not considered sterile. I shouldn't reach over my sterile field. I shouldn't turn my back to my sterile field. Okay, so I'm just going to move my table out the way so that I can go ahead and put on my sterile gloves. Okay, remember, got your right and left. You got those little folds there. You're going to use the folds to open up the gloves, getting that memory out so that the paper doesn't flip back onto the gloves and contaminate. You're going to glove your dominant hand first. I'm right-handed. I'm going to pick up the cuff, okay, because this is going to be touching my skin, so I don't have to worry about sterility there. Open it up a little bit, palm facing up. I'm going to slide my gloves on, being sure I keep my hand on the cuff. Pop, let it go. Don't try to fix the wrist. You're going to contaminate. So now for the non-dominant hand, you have to do it a little different. Remember, you're going to stick those 4 fingers under the cuff because you want to protect them. And you're going to lift your glove up as such, keeping that thumb out like you're hitchhiking. Remember, if you have small hands, you have to be careful that when you raise your hand like this, that the fingers are not touching your skin, okay? So you want to sort of come away from things so you don't contaminate. Open up the inside of that glove, keep that thumb out like a hitchhiker, and stretch that glove. Don't be afraid of it. Stretch, 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 work that hand in, pop, let it go. Please do not try to fix the wrist. Remember, if you pick this up from the center, you can dispose as such. Just drop it in the trash. Don't bend over. Don't let your hands drop below your waist, or don't let your hands go above your shoulders, okay? So you can keep your hands in the center, midline. Now, I can use my foot here to sort of bring my table a little bit closer to me, and I can also put my hands in the middle, keeping them away from the edges, okay, to sort of guide my table, however you choose. So now I'm going to start looking at my kit here. So every kit is different. Ours may be different from the one that you have. As you see here, I have these little paper drapes. Now, if your drapes are inside, once you open up the package, if your drapes are inside, they are sterile. However, some of your kits may come with one of your drapes on the outside. that means it is not sterile. And all it simply can be used for is a down sheet to catch any betadine or anything like that from staining the patient's sheets. So mine is my drape, because it's inside of the kit, is completely sterile. There's that shiny side, remember, shiny side down. And you're going to open it up. When you open it up, guys, make sure you're holding it up in a way so it doesn't get contaminated. And then that's the dull side. I want the dull side facing me, and I'm going to use this as a drop down, okay? Just to catch any betadine that may stain the patient's sheets. I'm just going to drop it, okay? Then I'm going to get in the middle and straighten it out like I want. Do not try to straighten from the edges, okay? So next, I have this extra drape here. Now, most of your kits will have this drape, and I'm going to open it up. This one is pretty huge, so you want to, again, hold your stuff up because you don't want it dragging all over the table. And you see that little hole there, okay? Well, the purpose of these drapes, and some facilities, just check on your facility's policy, will require use of these drapes. Some do not, and it's up to the nurse if they want to use it. But I'm going to show you guys what this drape is for. It's really to protect our sterile field because of the inside of the patient's thighs. So you'll go with the opening over the urethra or vaginal area, and you're not going to touch the areas. You're going to sort of drop it and work your way, straighten it in the middle as such, okay? So again, please don't try to straighten it by grabbing the edges. Just drop it and use the inside of the drape to fix it the way that you want it, making sure you don't touch the patient's skin. Now, you guys in your kits, you will have, it will say alcohol swabs. That is, we don't use alcohol for this procedure. We use betadine or iodine, or sometimes Hibiclens if the patient has an allergy. But this pack has actual iodine. So I'm going to open it so that you are able to see what the swabs look like. However, I'm not going to actually clean the mannequin with them because it will stain them, okay? So when you open this up, this one is pretty tough. Okay. So when you open this up, as you can see here, I have some swabs. And when you open them and take them out, they look like this, okay? Now yours will not, because it'll be alcohol so you don't stain the mannequin. But this is how they look, and you have 3 of them, okay? So I'm just going to sit them, take the top off of here, and I'm just going to sit my top there and store these betadine packs right there. But I'm going to go ahead and open them because at some point I'm just going to have one hand. And then also in this kit, you have some lube or lubricating jelly. It's sterile, okay? And it comes in a little pack like this. And I go ahead and squirt that into my tray. You can set this up however it makes sense to you. You don't have to do it exactly like me. Now this here is a urine specimen cup, and we'll get to that in a moment. But I'm going to sit this off to the side. I won't be using this during the sterile procedure, okay? Now we're going to get to the Foley itself. So as you see, here's my Foley. This is the actual catheter tubing, okay? This here is basically what we would use to draw any urine specimen, okay, for urine culture. And this here is where you're going to attach your syringe to blow up the balloon. And we're going to discuss the parts of the Foley in detail before you guys start to use it. This is your actual catheter that will get inserted in the bladder. So we have to take very special care to keep this sterile the entire time. And then the Foley catheter is actually attached to the tube in here and the Foley bag itself. At this point, we want to keep all of this sterile until we get the Foley inserted and secured to the patient leg. So now when you're taking off this sleeve here, you have to be very careful because you don't want to just pull this sleeve off and not have any control over your Foley, because this will go flying and hit your wrists or non-sterile areas, and then you have to throw it out. So just be careful. I'm going to throw that paper away, okay? And I'm going to go ahead and sort of put that in my box so it doesn't fly all around and get contaminated. So now what I'm going to do is you'll have a syringe. This is 10 cc's. Now you want to be sure that you attach this securely to your area here, because this is how you're going to blow up the balloon. We always use water to blow up the balloon catheter. Never saline. It will break down the material of the balloon and cause the balloon to rupture. Now, guidelines now are that we attach it, but we don't test the balloon. Test the balloon used to be we would attach this, press down, and see, look at the end of the catheter tip to see the balloon expand. I'm just going to show you guys what that balloon tip would look like when you fully insert it and blow it up inside of the patient's bladder. But remember, we do not test the balloon anymore. We do not blow it up until it is in the bladder. But I just want to show you guys so you can see what it's going to look like. Don't know if you can see that on the camera, but you see how that little balloon, this is going to keep the Foley from coming out of the patient's bladder. Okay. Now, I think I'm pretty ready to go ahead and set up. So, however you choose to do this is totally up to you. This is how I do it to ensure a smooth insertion without contaminating as much as I possibly can. So I'm going to now move my Foley kit between the patient's legs. When you pick this box up, don't pick it up like this, because then how are you going to lay it down without contaminating? Now, right now, this area here is still sterile, okay? However, in some instances, it may not be. So this is how the best practice: grab it at the top, drop it between the patient's legs, okay? Now, my lube is right here, okay? So I want to be able to have my lube and my betadine Q-tips nearby, okay? So I'm just going to make some room for these. Okay, again, just drop it. Okay, so I got it set up like that. Now I'm ready to start. Well, we did our perineal care, which was clean the urethra, meatus, labia minora, labia majora, all of that. We have already done that. However, now we got to clean again with using our betadine to ensure that as much bacteria is removed so we don't insert that bacteria into the bladder. Okay, so how we do that, either side you choose to stand on, you can. Okay, just remember your dominant hand. If you can't really do much with your non-dominant hand, you want to use your non-dominant hand to be the placeholder to expose the urethra. However, if you find that exposing the urethra, you can do it better with your dominant hand, and you can maneuver the Foley with your left hand. Non-dominant hand, that's up to you, okay? You pick your poison. So this is going to be my dirty hand. What I mean by dirty is once I take my hand and place it on the patient, I can no longer use this hand with any of my sterile products. Okay. So what you're going to do is take your pointer finger and your thumb, and you're going to expose that urethra as much as possible. Now, you will find, even on real patients, but especially on these mannequins, it is very hard. You know you're doing it right when your hands are shaking. So now, at any time, I can readjust. So make sure during this time you find a good spot to keep your urethra exposed, because once you start to clean with the betadine swabs, you cannot let go of you cannot let the labia minora close on each other, labia minora and majora close on each other, because then you're recontaminating the urethra. Okay. So I'm going to find a comfortable spot. I think that's going to probably be about as much as I can do there. I'm making sure that I keep my hands in place. Now I'm getting ready to do my betadine, my swabs. Now I'm not going to clean the patient with this, because I don't want to stain the mannequin, but you're going to go away from you, and you're going inside of the labia minora. Okay. We'll demonstrate more in class where you have more visibility. I'm just going to chunk that over there. I'm going to, so away on that side, on the inside of the labia majora, and I'm cleaning from the urethra down to not quite touching the anus, but you're cleaning like this down from the urethra down, toss. Okay. So I'm going to do the other side closest to me, covering the urethra down going towards the anus, but not touching it. Drop. And then the last one, I'm going to go straight down the middle. Okay. Making sure I cover the urethra all the way down. Okay. Still have my hand in place. At this point, if I moved my hand, I would have to get more swabs and re-clean the patient. You cannot let the urethra, you have to keep it exposed at all times after cleaning. So now I'm ready to insert the Foley. Okay. So this just takes some little practice and technique here. Now, I don't really care if the tubing, the plastic tubing touches anything, but I do care if this rubber catheter touches anything. And I'm just going to get some lube, okay? And then, as you see here, I'm sort of balling the catheter up in my hand so that it doesn't touch anything. And now I'm going to insert into the urethra. Now, once you start inserting, when you get to a certain point, you're going to see urine, hopefully. When you see urine, you'll state during the checkoffs, I see urine, and then you're going to insert the catheter Foley about 2 or 3 more centimeters after seeing urine in the tube, okay? So again, inserting the Foley. Once you see urine, you'll state, I see urine. I'm now going to insert the Foley an additional 2 to 3 centimeters, okay? You want to state this before you begin blowing up the balloon. The reason why is because when you first enter into the mouth of the bladder, of course, you will start to see urine in the tube, but you're not quite in the bladder. You're at the mouth or neck of the bladder. And if you do not go an additional 2 to 3 centimeters, when you blow up that balloon, you're going to blow it up at the mouth or the neck of the bladder, and it can cause the Foley to come out, or it's going to be very painful to the patient. You want to insert additional 2 to 3 centimeters to ensure that once you blow that balloon up, the tip of that Foley is inside the bladder. Okay, so we did the additional 2 to 3 centimeters after seeing urine, so we know we're in the bladder, not at the neck of the bladder. Now, with my right hand, I'm going to press down on the syringe. All the way, I'm going to use all 10 cc's. Now, if you do not keep counter pressure on that syringe, it's just going to backfill. And you can't see it here, but when we start practicing, you're going to see that happen. You can't disconnect this syringe from the catheter if you've had some backflow of the fluid, and that is because the manufacturer of the Foley says it takes 10 cc's of water to blow up that balloon and keep the balloon in place. Well, if you let some of that fluid backflow, it may only be 7 or 6 cc's and the Foley can come out. So you're going to have to keep pressure, right? So I don't know if you can see, but I'm keeping pressure so it doesn't backfill. Now at this point, I'm going to take this hand and pull on the Foley, okay? To make sure that the Foley is not coming back. I should be getting resistance. Don't pull hard, just a little bit, okay? So now, once I pull on the Foley a little bit, I got some resistance. I can now take this hand, hold the catheter, stabilize the catheter, and push and twist and pull off the syringe, okay? Now, so at this point, the Foley is in, okay? The balloon is in, the Foley is in the bladder. So what you need to now do is you need to go ahead and get get the Foley bag below the bladder, okay? Because what we don't want to happen is we do not want urine to back up in this tube and go back into the bladder. The bladder is completely sterile, the inside of the bladder. But once that urine leaves the bladder, it's immediately starting to grow bacteria. So if you allow the urine that is in the tube to backfill into the bladder, that patient is going to get a Cardi infection, okay, or UTI, okay, bladder infection. So once you have blown up the balloon, go ahead and start getting your Foley below the bladder, which would be off the side of the bed. Now, in your kits and in my kit, we don't have it, but it's something called a stat lock device. And I'll show you a picture of it in class. And basically, you would fasten that stat lock device onto the patient's skin. It's an adhesive, and you would secure this Foley in place. The reason why we use those stat lock securement devices is to prevent the pulling and tugging on the catheter. Because every time that catheter is pulled or tugged, it stretches the urethra, causing damage, pain, but also allowing for bacteria to enter the bladder. Okay, so we're going to pretend you're just going to state that I fastened my catheter to the patient's skin. What I do want to make a note of, make sure you got a lot of length here. You don't want to pull this tight like this. You're going to stretch that patient's urethra and possibly cause damage. So you want to sort of make sure that you have some, extra tubing so that it is not pulling. That way, as the patient moves, turns in bed, it won't cause that pain or irritation. So we're going to pretend that this is fastened to the patient's leg. It's off the side of the bed. Now, you guys can't see in the video, but you're going to then secure the catheter bag to a non-movable part of the bed, okay? Not the bed rails, not the foot or head of the bed, because remember, when you elevate, those parts move. Underneath the bed, there is a frame that does not move. And in most hospitals, their beds have a hook and it will stay for Foley. Okay. And that's where you'll hook it. You don't want your Foley bag to lay on the floor. It should be below the patient's bladder, but it should not be on the floor. And it should only be secured to a part of the bed that does not move. Okay. So we've done all of that. Now we're through with our, of course, we're through with our sterile procedure. So we're going to go ahead and start cleaning up our area here. Remove this. And you can have some soap and water on standby just to clean up a little bit of the betadine. Some facilities require that the betadine that you use to cleanse, you just let it stay there so it can continue to try to fight bacteria, okay? So just follow your facility's policy. Now, I'm going to put my patient's legs back in a comfortable position and cover them up. Okay. Take off my gloves, cleanse my hand. Now, what I want to go over with you guys next that you will have to perform and check off is how to remove a Foley, okay? But before I do that, I want to go a step further and show you basically how you would get a urine specimen from a Foley catheter, okay? You do not get a urine specimen from the Foley bag. That urine has now started to grow bacteria. Remember what I said. Once that urine leaves that sterile bladder, it is now growing bacteria. So if you was to take urine out of that bag and send it to lab, they're going to say that the specimen is contaminated because they can see all this bacteria that should not be there. Okay? So how you would do this, of course, you want to cleanse, sanitize your hands, put on clean gloves. This does not require sterile gloves. Okay. You'll get you a syringe. And remember our specimen cup, we have that. You want to be sure you do not touch the inside of the lid or the inside of the cup, because if you do, it's going to appear as the culture, the specimen is contaminated. So I'm going to put my specimen cup there. Now, what you want to do, go ahead. This is the balloon, okay? So we don't use that. If you pull back on that, you're going to withdraw the water and your Foley is going to come out. This area here is what you would use to get your urine specimen. So how you would do that, you want to make sure too, you don't touch the tip of your syringe here. So sometimes when you go into the patient's room, there won't be any urine in the tube. So what you will see nurses do is they will fold the tube as such, put this little blue clamp on there. And what will happen is if you take the side of your hand and press down onto the bladder, okay, right above that pubic bone, okay, and you press down, you can sometimes get, so you're pressing on the bladder to get some urine into that tube. But if that doesn't work, you can clamp this, cover your patient back up, raise their head back up, and tell them, I'll be back in 30 minutes, okay, or 15 minutes. Just don't forget, okay, because this, if you don't unclamp it, the urine will not flow freely, causing pain to the patient, okay, because their bladder will not be able to empty. So again, if this method does not work, Then you can keep it clamped for about 15 minutes and come back, and you should see some urine in that tube portion. So what you'll do, take an alcohol swab, clean that little port there, that area that is what we call a port, and you would take your syringe, okay, and you would attach it to that port, and you're going to pull back. Oops, sorry. You're going to pull back, and you should start seeing urine fill your syringe. Okay, and then you're going to take that urine, squirt it in your specimen cup, again, making sure not to touch the inside. Go back again, get some more urine. Usually about 20, 30 cc's is enough for a culture, and you're going to express that. Okay, we're done with that. Make sure you release that knot in the tubing, that kink in the tubing. You want the tubing to flow, be without loops, okay, big dependent loops or kinks, so that the urine can flow freely from the bladder. That is how you get a urine culture. Then you, not touching the inside of the cup or top, place the top back on and label with the patient's information, send it, put it in a biohazard bag, get it to the lab, okay? So that's how you do that. But now let's go ahead and let me show you how you would remove the Foley. So we're going to pretend, okay, just like on the cooking shows, we're going to show you the end product. So it's been 2 days, okay? Miss Johnson, you know what, for whatever reason she needed the Foley, she doesn't need it anymore. You verify the orders that the Foley can be removed. You verify the patient's identity to make sure you're taking the right Foley out, of the right from the right patient. And you're going to explain to the patient, I'm just going to remove the fluid from the balloon, and I'm just going to gently remove the Foley from your bladder, okay? Now, what you want to be sure of is that you are removing all of the fluid. Now, if you're not the one that inserted the Foley, some Foley kits may have 5 cc's of water in the balloon. Some manufacturers use 10. You can always check the patient's chart to see what was documented as far as how much water was used to blow up the balloon, okay? Or you can just take care to pull back the full 10 until you feel resistance, okay? And you start seeing like air bubbles in the tube, the Foley catheter, that's when you know you pretty much have removed the balloon. So I've already explained to Miss Johnson that I'm removing her Foley, check her orders. You just need on clean gloves, get you a clean sterile syringe or a clean syringe, and then you're going to go ahead and remove the Foley. Now, if you want, you can always put like a little blue chuck or something down just in case, to protect the patient's sheets, okay? So I'm going to go ahead, and now ATI will say you want to empty the Foley bag before you do this. And that is totally fine. However, you can discontinue the Foley and then measure and empty your urine afterwards, okay? The point is this: do not pull that Foley bag full of urine onto the bed so that the urine backs up and go into the bladder. Keep it below the bladder. So again, you can empty it before you discontinue the balloon, or you can wait, discontinue the Foley, and go take the whole Foley and empty it and measure that urine. Okay, so I'm just going to attach my syringe, and you'll notice when you do these in lab that it automatically starts filling up because of all that pressure, okay? So I'm just going to pull back a little bit, ensuring that I have a full 10 cc's, and that's what it looks like. All that pressure pop right off. So I'm not just going to go and snatch this out. Okay. I'm going to tell the patient I'm about to remove your Foley, and I'm going to gently, in a nice, good motion, steady motion, remove that Foley. If you feel any resistance, you want to go ahead, squirt that water out, reattach, and pull again. If you are feeling resistance, this is just to make sure that the water is completely out of the balloon and the balloon is completely deflated. Please don't keep tugging. First, empty the water you have in your syringe and pull back on the balloon to see if there's any additional water. And then again, slowly, slow motion, steady motion, remove the catheter. Okay. Sometimes you'll feel some resistance just because of the irritation of the urethra, may have caused a little bit of swelling of the urethra. So this came out, nice steady motion. Before I discard this, I'm going to look at the tip and say my tip is intact. If the tip of the catheter is missing, we need to document this, let the doctor know, because we can't leave that in the patient's bladder. Okay. So at this point, now my bag with the urine in it, I will take it to the bathroom, measure it, empty it, and then document. And this can go right into the trash. Okay. All right. So now at this point, I'll take these gloves off, clean my hands, of course, put on some clean gloves, and get my patient back into a comfortable position. Okay. We will talk more about documentation of insertion and removal of Foley catheter. Next, I'm going to go ahead and put my patient back up into a comfortable position. Okay, and she likes it about right here. And then I would lower my bed all the way down until it stops. And I would make sure that my patient has their call light, okay, before leaving the room. So patient, head of bed up and elevated to a comfortable position, the entire bed lowered to the ground as low as possible, call bell within reach before leaving the room. Okay, thank you so much.